Yes, aspirant, the time has rung and we have to start. So, hello and welcome you all to Sail to MDS Dental Academy. I am Dr. Malay, pediatric dentist, professor in College of Dental Science and director of the academy. So, today, aspirant, as you all know, the agenda of the today live session is how to plan for your government dental examination. So, first of all, why planning is required? Remember, your government exam is equally important as all other exams. If you are not planned properly, it is very difficult for you to move forward. Okay, why? Because you're going to get just hardly 80 to 90 days for the preparation. So in this 80 to 90 days, you have to take care in each and everything. If you miss at least 7 to 9 days also, it will be difficult for you to come up. Fine, aspirant. And today my video will be both in the mixture of the English and Hindi, because few of you have requested that sir please thoda Hindi mein bolna. So we will keep the mixture so everybody can understand. If you have doubt at any point, you are free to ask. So now, aspirant, in the description box you can check out one link I have shared. After this video, please go through that link also once, in which I have given the proper example regarding how to approach a particular subject, so that can be act as exercise for you and you will get idea how to go for it. So now, first question we'll ask, that many are asking, so what is government dental examination, whether it is like NEET examination or different thing. Remember, aspirant, the government dental exam is a highly competitive exam nowadays. If you talk about last 5 years, it was very easy that you read little bit, you go for exam and you get clear. But nowadays it is competitive, because the number of dentists between the age of 24 to 34 has increased, and those are only allowed to give the examination. You people have to compete with not only with this other student, but also those students who are giving the NEET exam also. So it is highly competitive examination, aspirant. So please don't think you all have to work hard. If somebody is telling you that just read little bit and you're going to get through, it is not like that. Because just imagine, aspirant, in few states like Maharashtra, it is coming after 10 years, and number of seats are also more, not 5, 10, 15, it is in the 100. So many students are going to go for the examination. Even students outside of your state are also coming for the examination. So please remember, this government exam, you have to be serious. It is highly competitive and you have to plan properly. You cannot, if you think that yes, just I will go for the little focus, I am going to get clear. No, aspirant, it is not at all going to happen. You have to work hard, because you all know that the government dental jobs are coming rarely in 2 to 3 years, and it is highly prestigious job. You are going to get good pay scale, 6-7 pay commission is very good. Along with pay scale, other perks, allowances you are going to get, your job security, and in the way it is one of the safest job existing for dental surgeons right now in India. And we all are lucky that 5 states has announced it. So please, aspirant, don't take it lightly and work hard accordingly. Fine, aspirant. Then few students are asking me, sir, when to start the preparation for the government exam. Some of you who are following me, you might have got the notice on the same date only, and some of you might have got late. But no worry, aspirant. Whenever you are realizing that you have to want this government job, you have to start your preparation. See, whenever we start the preparation, it always look difficult. The two category of students are there. One category of students, those who are preparing for the NEET examination. For them, it is simple, extension of the preparation. For them, it is not a big deal. But for second category of students who are practicing from 5 to 7 years, who have not touched the textbook, who are, just in the practical side, for them, little difficulty will be there. Okay, but that difficulty will be in the initial 5 to 10 days. If we say 90 days of preparation we have, the first 10 to 15 days are always difficult. Then the remaining 50-60 days are mid. Remember, in the preparation, the timing never get easy. The preparation never get easy. It is always tough. Till the exam, till the paper you give, you will feel, yaar, ye exam ko padhna to bahut difficult hai. But after once you clear the exam, you will keep on telling to everybody, the government job is like a cakewalk. You can clear. But initially, remember, aspirant, it will be always difficult for any students out there preparing. Sometime when you open the book, you may feel drowsy, you will think, no, I don't want to study this, but it is going to happen. For that aspirant, remember you have to follow one simple rule I am telling, that is a Kaizen rule. It is given in one of the beautiful book. What that book says, that you have to take small step at a time. Okay, in that book one beautiful story is there I want to share with all of you, that one old lady was there with no husband and two kids. She only used to work full day for the livelihood of her children, and with a period of time like 3 to 5 years she became a little obese. She became, and everybody used to tell her, you have to keep on walking, you have to jog, you have to restrict your diet, and she become very furious and angry. यार सब बोलते रहते हैं कि मुझे चलना चाहिए, पर मेरे पास टाइम ही कहाँ है, पूरा दिन मैं काम करती हूँ, घर संभालना, बच्चों को संभालना बहुत डिफिकल्ट होता है. Then once she become very ill, she is going to the doctor, and doctor telling her similar thing, that madam, every day you have to walk for at least 1 hour and you have to take control of your diet. She become very angry, complete red face. Doctor was very experienced. He understood that she has some or the other problem. Then doctor told in very easy manner, madam, you have to walk only for 5 minutes in a day, and that is more than enough for your life. She become happy. 5 minutes I can give anyhow from the 24 hours, and in that way she started walking for 5 minutes. Eventually she only seen the improvement. Then that 5 minutes become 20, and then automatically over a period of 3 to 5 months her obesity was solved. So in the same way, aspirant, when you start preparing for any government exam or any examination, the initial 10 days are very difficult. Some students who are just clearing the 10 days, they are going through the preparation. And I have seen out of 10, 7 to 8 students will call me and tell, sir, I cannot prepare for the government examination, मेरे से जितना हो उतना मैं देके जाऊँगा बस. But please aspirant, keep on working. Follow the Kaizen rule, small step at a time. You cannot sit for 2 hours, at least have a 10 minutes session and try to study. Okay, so remember, today only you people have to start the preparation, and those who already started, be little more serious in your preparation. Hope aspirant all are awake. Let's go for one important question. Students are asking me, sir, how to prepare for the examination? 90 days, 21 subjects, what we do? Very simple thing, aspirant. You all know the triangle, the pyramid. You know the base of the triangle is very broader, and then as you reach the top, it will become the narrower. So aspirant, what is the base of the triangle? Those are your concepts. What is the middle part? That is your multiple choice question. At the end top you can see little thing, that is your revision. Fine aspirant. So always remember that don't just directly jump to the MCQ. First have a proper concept. Let's say simple example. If you people are knowing about odontogenic tumors, let's say, then you can answer 100 MCQ of the odontogenic tumors. But if you are not knowing odontogenic tumors, gone, you cannot answer. So please build your proper concept. I know difficult it will be, but as you go gradually, more MCQ with confidence you can solve. Fine aspirant. So how you will get to know the proper concept? You can go with our academy lectures. See, I have devised academy lectures with so much work hard. Okay, we have providing the video, audio, voice note, images, links that can be used as a notes also. So please go through them properly once or twice you have to go through. Remember, एक बार में किसी को याद नहीं रहेगा, 1-2 बार तुमको वीडियो ऑडियो को सुनना होगा. और मैंने continuous 3 hours I have not made. I have made in short burst, so you all not may feel bored for the same thing. Okay, so that concept will come from my academy lectures and also from synopsis of the pulse. Okay, then the second thing will come the MCQ. Remember, if you approach to direct MCQ, imagine you are reading 100 MCQ, you will read 100 concept. But if you will read 10 proper concept or 100 proper concept, you can answer thousands of MCQ. तो हमेशा याद रखना कि हमको मास्टर ऑफ कंसेप्ट बनना है, मास्टर ऑफ MCQ नहीं बनना. MCQ automatically we will reach there. Then come the revision part. Sir, 90 डेज में हम लोग रिवीजन कब करेंगे? यस एस्पिरेंट, यू हैव द टाइम व्हेन यू आर गोइंग टू डू द रिवीजन, आराम से कर पाओगे. रिमेंबर फॉर एग्जाम्पल टुडे यू हैव स्टडीड सम 2-3 chapters or 100 things. Same day you have to do the revision. Before you sleep or before you end up your work, revise in 10 to 15 minutes whatever you have done. Why? As you all know, we have two type of memory in the mind, short term memory and long term memory. So whatever you are studying today, for 4-5 days you remember, but afterwards you will tend to forget. The tapering of knowledge will occur. That's why what you are studying in the morning today, revise in the night also. So the short term memory will be converted to long term memory. So aspirant, again I am telling you the pyramid of preparation, that is the concept, MCQ and the revision. This you have to follow. It will be difficult aspirant, but that is the proper direction for your exam. Remember, when you are going for government exam, you people don't have to work just for these 3 months. You have to work till the interview. Okay, that's why the proper effort you people have to give. Fine, hope now you people are a little bit solved that how you have to prep for the examination. Then comes the biggest question. So what is the exam pattern? So what is the syllabus? Simple thing. Remember, the syllabus for the any examination is the DCI recommended syllabus from first to final year. You know aspirant, sometime what happened, this government authority will either give 4 to 5 pages of syllabus, some people will give 1 page syllabus. But whenever we prepare questions for the examination, I myself was a part of 2 to 3 exam preparation recently. We prepare from the DCI recommendation only. Okay, so don't think that in your syllabus the vagus nerve is not given, they are not going to ask the anatomy of vagus nerve. They can indirectly ask from the general medicine also. Okay, so first and foremost thing, please study properly. Exam pattern nowadays has completely changed aspirant, not only for your government, for NEET, INSCT, everything. आज से 5 साल पहले आप मुझे पूछते, मैं बोलता कि रिपीट्स करके जाना है, रिपीट में से 50% आएगा, क्योंकि पहले जो एग्जामिनर पेपर बनाते थे वो एक ही होते थे, एवरी ईयर द सेम प्रोफेसर यूज्ड टू बी एग्जामिनेशन. बट नाउ डेज एवरी ईयर द प्रोफेसर कीप ऑन चेंजिंग, द क्वेश्चन कीप ऑन चेंजिंग. If you see recent 5 exams, 1 HPSC and 4 GPSC conducted, no repeats were there aspirant. No repeats, hardly 1 or 2 we can say repeats. You need also hardly 4 to 5 repeats were there. So please don't just focus on the past papers aspirant. Okay, past papers you have to read for a reference. Okay, and on our website all the important past papers we have provided. Please see the past paper of the NEET and SRship also. Recent in our Gujarat government examination in Posto, they have asked many questions from the SRship also. That's why past papers you have to go limitedly, don't just bank on them. Just 2 days back one student asked me, sir, in Chhattisgarh past paper I have seen they have asked from 3 subjects only, prosto, ortho and perio. Sir, shall I study these 3 only? No aspirant, it is not like that. You have to study everything. You don't know from where all they can ask you. Yeah, for government exams 60 to 65% preparation is your clinical subject and the rest 30 to 35 is your basic subject. But you can see microbiology, sterilization they can ask from clinical point of view also, anatomy also they can ask from clinical point of view also. But clinical 65% they will ask and 35% basics they will ask. That's why aspirant, please, exam pattern has changed, so your way of approach to our subject should also change. Now the biggest question student are asking me, sir हमारे पास पल्स है, आपकी एकेडमी ज्वाइन की है, क्या पढ़ना चाहिए? My academy notes you have to read. My academy exams you people have to give, because there are no questions repeated from the Gauri Shankar or Pulse. So you will learn new thing. Sometimes when you see my academy papers, I given some bizarre questions. I give some all of the above. Why? Because when you learn one question, you can read 3 to 4 concepts. Why I am telling you to read Pulse? Because Pulse have around 5,000 to 8,000 MCQ. So that is going to help you to revise more and more things. Okay, then as remember, Pulse no need to buy latest edition. If you have older edition, no problem. Synopsis in all the edition are equally same. In new edition they are keep on adding latest papers which are available on our website. So any edition of Pulse you have, no problem, practice MCQ from that. Okay, any addition, maybe 8th, 9th, 10th, 11th, 12th, 13th, 14th, no problem. Okay, you have to use your pulse for your synopsis reading and to practice MCQs. Around 5000 MCQ you are going to get from my website. The other 5000, 8000 you can read from the pulse. So it is very simple thing. Fine aspirant. Then how to solve MCQ. Whenever हम सबको हैबिट है कि हम MCQ का क्वेश्चन देखते हैं और हमको गेस करना पड़ता है, हम गेस करते हैं उसको, हमको आता है तो हम लोग 100% गेस करते हैं, नहीं आता तो भी हम लोग ऐसे ही उसको गेस कर देते हैं. But remember aspirant, this guessing work you don't have to do in your preparation. Why? A simple thing I am telling you. If you are seeing one question, okay, and you are not knowing that concept and you are just guessing it, then what will happen? Imagine when you are guessing, there are two things: 50% right, 50% wrong. If 50% it is wrong and you are seeing the right answer, then also there will be two answers in your mind. If you are right, then also you will doubt in your right answer. So when you will be on the screen when you are giving the exam, two questions will pop up in your mind. Two answers will be pop up in your mind, and you are going to land up making mistake of 5 to 7 MCQ. Mind all aspirant. My students have made this mistake. From there I am telling you the things that whenever you are reading MCQ for the first time, if you are not knowing the concept, don't guess it, see the right answer, read the explanation. Guessing work we don't have to do when we are reading for the first or second time. Okay, please take care of all these things aspirant. So whenever you approach MCQ, if you are knowing the concept, approach it, otherwise leave it, see the answer and go for it. And about negative markings in your exam aspirant, negative markings are there in all the examination. If at all any changes they are telling, definitely I am there to help you. And when you are going to be on the screen of the examination, or if at all OMR exam is there, they are going to provide you all the instruction regarding the same. And some of you are asking me regarding the general knowledge. Already I have mentioned in our WhatsApp group that what all books you have to read. Simple GK book come regarding your state, refer them once, have passive reading of around 10 to 15 minutes daily. That is going to help you. So I hope now everybody is clear to know how to approach to the particular MCQ. Please don't play guessing work. Then aspirant, come to the crunch part, how you have to prepare, how you have to learn. Now 3 category: 4 hours, 6 hours and 8 hours. Remember aspirant, some of you are telling me, sir, we are doing practice from morning to night, we don't have time to read. Aspirant, my 3 students were there in the recent GPSC tutor ortho examination. 8 students were selected, 5 MDS ortho and 3 BDS. Those 3 BDS got the highest mark aspirant. Okay, those all 3 are busy practitioner. They used to divide their time. Morning 2 hours you can give, like between 5 to 7, 6 to 8. Afternoon 1 hour you can give. Before sleeping 1 hour you can give. So in the initial 20 days you have to give 4 hours. Then in the middle part, that is 50 days, you have to give around 6 hours. And at the end you have to study around 8 hours only. No excuse for that. Aspirant, you people have to study in the beginning at least 4 hours. You people have to manage your time if you want this job. I am telling morning 2 hours you can give. When the patient is not there, that you can give. For my academy student, it is very simple. You can, if patient is not there, you can open up your mobile and you can see the audio, video, voice note, images, and you can keep on learning from the same. Okay, but 2 hours you have to give in the morning, 1 to 2 hours in the afternoon, at the end of the day 1 hour. Like that aspirant, you have to give proper timing. Now let's divide the subject, topic and day. Already I have mentioned in one of my video, the link is there in description box. I have divided the subject in 4 categories: long clinical subject, short subject, pure basic subject and interrelated subject. Okay, so aspirant, please go through once that. Okay, for each subject I have given specific day, ideal day I have given. You can do plus and minus based on your availability or how you thought. Let's take one simple example of the endodontic subject. For endodontics, we are giving 4 to 5 days. Let's say we are giving 5 days. First day, what you do, 1 to 2 times read my academy lectures. Simple thing do on first day. Now what you are going to do for remaining 4 days? 3 days you are going to read endo from the pulse. Let's say 8 to 9 topics. You can see in the index of the pulse, endo is divided into 8 to 9 topics. Every day do 2 topics. In the way 3 days you are going to complete 8 topics. Last day keep for the revision or something you have missed or for the examination. Okay, fine. Remember, even if you are not able to complete 100%, switch on to next subject. 21 सब्जेक्ट का एग्जाम है, 21 के 21 सब्जेक्ट पूरे करने हैं. किसी एक सब्जेक्ट में मास्टरी नहीं करना है. One of my student is reading a subject from 10 to 12 days as one subject. Please don't make such mistake. If you are giving 5 days to a particular subject, how much? 50% do I? Switch on to next subject. Whatever the left, we will see at the end of doing the revision time. Please mind it, aspirant. Okay, so I have divided the subject. Okay, we have divided the topics, we have divided the time. Now पूरे दिन में पढ़ना कैसे? Let's say 4 hours तुमको दिए. In that 1 hour after completion of my academy lectures, 1 hour read synopsis, 2 hours practice MCQ, and if you don't have time, don't read in detail all the explanation of the pulse, just question answer. जहाँ पे लगे कंसेप्ट नहीं पता चल रहा वहाँ पे एक्सप्लेनेशन पढ़िए. सो 2 घंटे MCQ and 1 घंटा रिविजन करिए. Okay, so in this way 4 hours of a day you have to divide. In that manner you can divide 6 hours also and 8 hours also. Why I am telling you this, aspirant? Because some student do पूरा दिन MCQ पढ़ते रहेंगे, पूरा दिन synopsis पढ़ते रहेंगे. You people will feel bored. When we eat food also, we have different items. The same thing you have to keep for the learning. Morning you are reading synopsis, clinical time easily you can do MCQ. You have practice MCQ, some patient come, you can close the book and you can do patient also. Fine. And at the end 1 hour for the revision. Then in my lectures there is one word, PPM, physio pharmac medicine. You have to study them in interrelated manner, overlapping manner. Like physio का CNS पढ़ा तो pharma का भी CNS पढ़ लो, medicine का भी CNS पढ़ लो, कभी भी नहीं भूल पाओगे. Okay, I hope now you people have idea that how you have to divide your subject, days, topics and timing. Fine. If somebody have doubt, you can ask me the later also, and also you can rewind video at the later on. Now comes the important thing, that is high funda versus basic funda. Remember 100% का पेपर होगा, 80% will be very basic paper and 20% high funda will be there. So if you are good in your basics and common question, you are going to get through the examination. Okay, don't crib for the simple thing. Now for example, if in one of my video we explained about the how to alter the cast for the distal extension partial denture. Okay, we have told what impression we have to take and when we have to take. Now you don't have to see the procedure, don't go in so much unnecessary detail that how to alter the cast, the procedure, anything. No, for examination you require that much that you have to learn. That is multiple choice question. You are not going to give the theory for the same. Okay, so please don't run behind those high funda things. वो 80% बेसिक फंडा है, उसमें ही हमको स्कोर करना है, वो डेंटिस्ट्री में हमको स्कोर करना है. Whatever the GK is there, current affairs you have to do, keep it aside for 5 to 10 minutes. Every day we used to scroll on Instagram, Facebook. When you're scrolling that, you can read newspaper for the current affairs. Okay, so in that manner you have to plan those 20% things. Focus mainly on the dental aspect and very basic 80%. Now aspirant come the big thing, that is doubts. When you people will read, doubts are definitely come, and I am the person who are going to help in the doubts. But remember, doubts are of 2 types, real doubts and the false doubts. How it will affect your preparation, that also I am going to tell in the later part. Real doubt means what, aspirant? Let's say if you people are studying about ameloblastoma. Okay, now the question has come on the ameloblastoma. You don't know what is ameloblastoma. Okay, then you are asking on the Facebook or to me the question regarding ameloblastoma. That is the false doubt. That doubt is because you are not knowing the concept of ameloblastoma. What is real doubt? Even after reading ameloblastoma, you are finding difficulty in the histopathology. That is real doubt. Now, how this real doubt and false doubt will affect in your examination? Simple thing, experience. Nowadays, we all have habit. Then, whenever we facing some doubt, we used to ask our staff or Google it. Everything we do. And mind will experience, whenever you are using Google, false information are there. Use Google Books. Okay. So, aspirant, whenever we are facing such doubt, we tend to ask some people, but don't do like that. You have a textbook. Let's say Sjogren syndrome, you don't know. You are opening textbook. I'm not telling you to read full Sjogren syndrome. At least 2 points, 3 points you will read. Along with that doubt, you will learn 2 more concepts also. And your confidence regarding the doubt solving will increase. You know, you once habit has become सबको किसी को doubt पूछना है. So exam में क्या होगा? When you see the question where your doubt, the habit will be there. Okay, किसको पूछूं मैं? But at the time you can't ask anybody those 3 hours. So what will happen? You'll end up in wasting the time for that particular question. So try to solve the doubt on your own with the help of textbook. Okay, even after that, if there is real doubt, you can approach me. Why? Because you should have, your mind have that exercise of solving and reaching those doubts. And when you are going to solve the doubt also, along with the doubt, 2 more concepts you are learning, 2 more MCQ you are learning. Okay, aspirant. So that is how you have to doubt. Now some people are asking and comparing themselves that sir, मेरे friend ने तो इतना पढ़ लिया है, वो तो नीट की एग्जाम दे रहा है. Let him or her do his or her work. You people do your own work. Whenever you are preparing for the MCQ examination, aspirant, don't compare yourself with anybody. Okay, you don't know how much knowledge is there. You know, the particular student, those who are practicing, they have a lot of knowledge, lot of clinical exposure is there. Some clinical question comes, sometimes the students who are not practiced, he or she may have the doubt, but those students who are practicing, you can use your knowledge also there. Fine, aspirant. So don't compare about it. And few of you ask me in GK what all they can ask about the basic politics of the state, geography of the state, or such thing they can ask. I'm going to share the book, you can go through that. And every exam have different weightage. Already the video has been uploaded for the same, that which all exam, how much weightage is there. Normally 150 mark paper is there, 100 mark dental they ask, and 15 marks GK they are asking. Fine, aspirant. And some of students have asked such a weird question also. Sir, have you cleared the government exam? Yes, definitely, aspirant. During my time when I was doing my MDS, I have cleared the government exam, but I am not top because I was doing MDS. But now the days have gone. I am not going to give the government exam. I am going to set papers for that. Okay, aspirant. And please, this is the way you people can go through. If somebody have not joined my academy and want to join, the details are there in description box. We provide lecture as well as test series. So we have discussed 10 things experience. We have discussed about what is government exam, when to start preparation, how to prepare, exam pattern, MCQ, about pulse we have discussed, then how to divide your day, time, subject, lecture, everything. Then we have talked about how to reach to basic funda as well as the advanced funda, how to solve your doubts. At the end, we have discussed that please don't compare while planning your preparation. Now the window is open for you. You people can ask us any doubt regarding your preparation. Definitely, I am going to solve it for you. Okay, aspirant, and any problem, let me know.